I don't think you can really anticipate what your caregiving journey is going to be about until you've walked that journey. May the 14th, 2014, when my father took sick, I would take on full-time caregiving duties for my father.
I looked after my husband for about 10 years. When we started on the journey, we could still go out, we could still do things. But as his disease progressed, I was more and more limited.
With our second child, along came the new role of caregiver.
I'm a caregiver for my husband. He has early onset dementia. It was difficult because he couldn't be left alone, so he couldn't work anymore. He couldn't drive. It was very devastating. It really was.
Co-design is an approach that allows healthcare providers and caregivers to come together to make improvements within a service area. It's very partnership-based. It involves gathering a variety of information and then coming together and looking at this information to see what changes or improvements can be made. The focus within co-design is really on sharing lived experiences and working together to make positive changes.
We really worked with those partner organizations to find the caregivers and the healthcare providers that were already working daily and interacting with each other and having those key points of contact that we knew we could improve as a project in response to some of those concerns we heard during engagement. So where caregivers were being recognized, where we could improve communication, and where those opportunities were to provide more education and training.
The caregivers and providers worked together immediately, fairly seamlessly. I think it was really beneficial the way we did our co-design because we had the same groups coming back every week together. So in the beginning, we may have had some quiet people who sat back and listened, but by the second meeting, they felt that they had a great perspective on what was going on and they had things to share. And they did see through telling those stories together at the beginning that they did have a common goal.
We heard a lot that the caregivers and healthcare providers couldn't tell who was who in each session. From week to week, you couldn't tell if the person was a healthcare provider, a physician, a nurse, or a caregiver that might have been coming out to do something like this for their very first time. That was a rewarding thing for both the caregivers and the healthcare providers.
Every family and every patient and every caregiver, it's such a unique individual situation. So this really helped bring the services together. When I saw the different aspects of the project, it just really got me excited about being so positive and solution-based.
I thought I would really like to do something with my time, something that I felt was passionate for me, and paying it forward for other caregivers to make their journey a bit easier. We were a team. There was a cohesiveness there.
I decided to become involved with Connecting the Dots because I really wanted to try to make a change for other caregivers. I thought maybe it was going to be very intimidating, working with healthcare professionals, but we just meshed together like a group. It was amazing. It was just like you were one big family.
Part of my role is to advocate for clients and caregivers. They're actually having them seated at the table and having their own voice heard as equals with care providers was really special. When you have them seated at the table, having their own voice and working together, you have more buy-in from clients and caregivers to what's being implemented.
I was so impressed by the healthcare providers that were in our teams. A lot of them were astounded because they didn't realize that caregivers were going through what they were, and they also showed a lot of respect for caregivers.
I would say that there's the investment early on, and we had talked about this, that sometimes things take longer, and so you have to invest more time. But I find now it doesn't take up more time, but it is far more rewarding. I'd say that the partnerships that we've made with caregivers and community, in fact, are really rewarding.
what we've learned collectively throughout all aspects of our project is that the caregiver's voice and perspective really can influence how providers think differently about how they go about their day-to-day work. We've had this great opportunity from the Change Foundation to make improvements for caregivers. I think as we move forward, hearing our stories that have been shared will continue to promote having both the caregiver and the patient involved together in every part of their healthcare journey.
We all know group work is really beneficial, but seeing how powerful group work was, or in this case co-design, bringing leaders and caregivers together and frontline workers together to solve problems really let us see every perspective. I think that it's really important through this to recognize that you can't predict who's going to have that groundbreaking idea or who's going to switch your perspective to get the best output.
We've heard repeatedly from healthcare providers that they can sit in education sessions, they can read textbooks or manuals about what they need to be doing in their day-to-day work. But what really tweaks their practice and how they look at things is hearing those stories from caregivers.
I think being involved in the Connecting the Dots project has really shown to me the power of co-design, bringing together frontline healthcare providers and caregivers who experience the health system in their day-to-day life. It is a way that we are able to make change. Oftentimes, change ideas come from the top level down, and by working with people on the front line and who experience this in their day-to-day life, we're able to make really valuable contributions and changes to our healthcare system.
Well, first of all, co-design is amazing. I'm totally sold on the process. It's really giving me hope. I have been in healthcare for 28 years now, and it's my first opportunity to sit on a co-design process committee, and it was phenomenal. It gave me a lot of hope in where we're going in healthcare because it was the first time I think that we were real partners.
When you have caregivers and clients and healthcare providers all involved at the same level, you can't lose.